Right, hi everyone. How's it going? Thanks for showing up. This is like the headline act for the Academy stage, so you're lucky to have shown up. All right, so welcome to the presentation. It's called How to Make Your Data Work. And realistically, what we want to do is show you in a super practical, simple way how you can take data and use it every day in decision making if you're a marketeer or if you're in medical affairs, right? We've heard loads of ideas. We talk about AI. We talk about how we've got these data lakes and we have to bring everything together. But there's a lot of people who are feeling overwhelmed with this information, marketers on the ground who are trying to do campaigns, right? So we want to give you some simple advice on how to do it. And I hope what you'll take away from it is something that you can try out, like a starting block, basically, to make things simpler and to create an effect. So yeah, overall, what you'll take away, number one, you'll get some practical opportunities to see some unique data that you've probably never seen before, and you'll also get some tips on the types of things that you need to understand, so simplify the data that you need to collect from doctors, and then also, like, you'll see how it can be integrated in one place to make things a little bit more seamless. And do use the QR code if you want to sign up. Basically, we'll show you some tools, give you access to some demos, we'll give opportunities to see us present actual case studies from people who have used some of these tools to good effect. So please do that, and you'll get emails, and you can chat to us one-to-one as well. Okay, so first thing I want to address, we've heard a lot about this, is that healthcare professionals and pharma are not having a particularly good relationship right now. Okay. If you guys think about when you need to make a decision about something, or if you've bought something complicated, like a car or a house or even a new laptop, right? Think about the amount of time that you've had to spend researching that. Like how many websites, apps, comparisons, maybe going into a store, speaking to someone. It's quite a lot of hours, right? It requires a lot of engagement. So can you imagine how much engagement it takes for a doctor to change their mind on a treatment that they would use for a patient? It's not like they're going to go on your web page or talk to your MSL and change their mind. You need to have regular, consistent engagement where they believe in you, it's transparent, they're interested, and you can have scientific exchange to make decisions, right? And we're not getting this right? This is data from Indegene. Everyone can access this on their website. 70% of doctors feel that reps do not understand their requirements completely. 62% experience product-related promotional content fatigue, so we're pissing them off, basically, with too much content. And 55% feel overwhelmed with pharma content. And that's doubly annoying when you look at how clinicians are feeling. Mainly burned out, overwhelmed with admin, they're saying that their work is emotionally exhausting to a high degree. So in this situation, it's not good to be annoyed by companies trying to sell you products, right? You need to have relevant, interesting information. And the reality is, like, 16% of UK doctors access the pharma website in a 3-month period. That's terrible. It means that despite this situation, we're doing literally nothing to support them. Okay? So we really got to ask ourselves, is our content valuable? Is it relevant? So what do doctors want? This is EPG survey. You can't see the data here, but again, it's pretty obvious. They want resources. They want disease awareness information, diagnosis information, guidelines, e-learning, opportunities to engage, interact with each other, and share scientific exchange. It seems pretty obvious, but if you ever look at this report, or we'll share the slides with you afterwards if you've signed up, you'll see that we always get it wrong. We think that doctors don't want that stuff, and we think they want product information and prescribing information, and they say they don't. We also think that they want to have interactions with field teams. They say they don't. People want self-serve content to make decisions themselves, and it needs to be timely and relevant, okay? So the thing is, like, there's all this stuff to sort out with engagement. People talk about AI, omni-channel. They talk about the field teams. Like, there's all this stuff to sort out. And I really want to get to the bottom of, like, where would you start if you want to differentiate from your competitors and engage, right? We want impact. We don't just want engagement. People like Netflix, for example, people's attention. We need to sell products, change behavior. So we've already established if you want impact, you have to have frequent, deep, and regular engagement. If you want good engagement, you have to have great content. You have to have great opportunities for people to engage with you that they actually appreciate. The differentiators of content between companies is not, again, going to be AI-driven. It's going to be based on on your strategy? Do you have a good strategy to understand what the audience needs and provide them with engagement opportunities? For good strategy, you need insight, and for good insight, you need data so that you know your customers better. So for me, like the first place to start before we can get any of the rest of this stuff right is, do we have the right data? Can we use it in day-to-day decision making? And can we use it to create insights that provide unique opportunities to engage with doctors on information that's new to them and stuff that's relevant that we can provide, right? So data and insight is where we differentiate. And what I want to show you is just something simple. So instead of thinking of all your omni-channel campaigns and touch points, one, what data can you use? And Lee's going to show you some like data that you might not have seen before that can, like, it's super meaningful, where you can engage with doctors at a market level, provide them with information they might not have seen. Then how can you take that strategy and create super engaging webinars and campaigns that get frequent, good customer experience and people are interested in it? And then how can you use your data at the one-to-one level, say if you're a rep or an MSL, to look at all the people who attended this, because these are the people who are actually interested in what you have to say, and reach out to them only, not everyone else who's busy with their patients, but how can you use that to then be super personalized and be relevant to them and build a meaningful relationship? So that's what we're going to show you. And we're going to start with understanding the market to form a strategy. And I want Lee's from R2 Insight. He showed me some stuff that blew my mind. As a marketeer and an agency, something that it's the stuff that dreams are made of in terms of being able to create campaigns. So here's what he did. Tell me when to move on. Oh, you can have it. There you go.
Yeah, that's super. Hi, everyone. Yeah, so my name's Lee Sims. I'm the CEO of R2 Insight. We've spent about 5 years trying to understand how to interrogate and interpret internet search behaviors in order to create meaningful local insights around what patients are really looking for, and then work out how to put that into context. We've been working with the NHS for a number of years as well to try and leverage that information with population health data to help them address healthcare inequalities and find out where are the gaps, where are people not receiving a good service, and what are they searching for, and hence how can we connect and communicate better. We're now launching our platform into life sciences, and what that allows us to do is on a hyper-local level, anywhere in the world, whether it's international, whether it's regional, whether it's city, we can look at internet search behaviors within that geography for any disease, product, or symptom, and we can look at the trends and the changes as to what are happening between geographies to get an insight in variation of expressed need. And then we've worked out a way to overlay that with a geographical matrix that means that we can look at population health data that gives context to that insight. So we can start to look at ethnicity, we can start to look at age, we can start to look at deprivation. We can also overlay prescribing of your drugs, your competitors' drugs. We can look at hospital performance data, all within heat maps that allow us to look at those geographical variations in behavior and get some context and understanding of the world that the HCPs that we're all looking to try and identify, target, communicate, and to Dan's point, engage with. We want to provide them with something that's pretty new and pretty different so that we can stand out. Now, we've done a number of different programs with a number of different companies. As you can imagine, we've used it in sort of targeting and prioritization, where we run the data on symptomology as part of a launch strategy, which allows for a client to pick which regions they're going to launch into. We've done rare disease launch programs, which means people can choose which section of the market to prioritize. But for the sake of today's presentation, I think the most important example, which we can follow up and share with you, is a program that we've been running in the field of menopause around HRT. And within this example, this is much more of a mid-life cycle scenario with our client. And they're looking to change their campaign depending on the makeup of the geography. And in this instance, what we were able to look at within micro geographies across the UK, we could start to see massive standout patterns between deprivation, HRT prescribing, antidepressant prescribing, and online search behavior. And we were able to profile and see 3 different personas that lit up across the UK in various geographies on that topic. And in the wealthy areas, in the more affluent areas, HRT prescribing was super, super high. Online search was heavily driven by insomnia supplements and various other holistic care packages that people were looking for. So persona 1 for the client is to communicate with medical professionals in those geographies on those types of topics. At the opposite end of the spectrum, in the super, super deprived areas, there was virtually non-existent HRT prescribing and non-existent search behaviours on menopause. Therefore, the client is going out and engaging with those customers around disease awareness, education, trying to create bespoke materials to drive people into the clinic. And the undeniable most important third sector was the areas where there was moderate deprivation and there was growing symptomology search. And in those areas, HRT prescribing was low, but antidepressant prescribing was through the roof. And as such, the client was able to create webinar programs, content engagement programs, email outreach programs, tactics for their reps, that was all based around this misdiagnosis of patients where they're in deprived areas, they're switching on to symptoms of menopause, they're presenting to the doctor, and they're receiving the wrong treatment. And by putting that topic out there into the HCP landscape, they're getting far, far better engagement, far, far better attendance rate to webinars, et cetera, et cetera. And when we take that type of insight, not only is it good for strategy and tactic, but it becomes good for HCP targeting and webinars. And pass back over to Dan and Julia to talk about how that piece of work intersects with both of their worlds.
So it's pretty cool, right? Like, I think, like, you know, if you think that you can go to a doctor and say, like, hey, we have this insight in why, like, you know, antidepressant prescribing is too high in these areas, like, you can create educational campaigns around this. I mean, if you can put yourself in the position of a doctor, if you are one, then you're going to say, like, okay, Pharma comes up to you and says, I want to talk to you about this and help you and support you with this. It's an insight that you might not know, versus, hey, we want to come and talk to you about our new product and how our new data is slightly better than the other product. Like, you know what you're going to choose, you know what you're going to focus on. So it's great stuff for, like, agencies like mine that like content marketing. So the next thing is, okay, so you've got this idea of this, like, content theme. Say, for example, webinars. EPG said doctors like webinars. It's like a thing that they prefer to engage with. So say you decide for your campaigns, right? Your main campaigns are going to be a series of webinars, and it's going to be on the theme of misdiagnosis of HRT for HRT therapy as depression and deprivification in different areas. So you've got that going, but you need to create a great webinar experience, right? So you also need to get that right. You need to be planning webinars regularly, and they need to be with the right people. They need to be on the right theme. They need to be trending and attractive. So, Julia, can you tell us, like, what kind of data do you think people will need to plan this, like, to give them some advice on that?
Yes, definitely, and I'm very happy to do so today. So we have all the insights from the market, and we have a very clear idea what is our webinar about, but not perhaps in each detail, and we are not sure what is the real topic. We had a look at the market. Lee gave us insights, but now what is the specific topic? And we have a lot of data, a lot of disease data coming from the disease, not from the specialty, understanding different tags around the disease, and then seeing this is exactly the topic. Or, for example, we can see what are the most asked questions from HCPs around this topic, around this disease. And this will really help you to understand what is the topic I have to talk about in my webinar. Next thing is find the right speaker. You have the questions that are frequently asked, and then you can let you show these are the people that really can answer that question. And these might be the right people, but there are also other things, other filters you can use to really understand these are my specialists because they have publications around the topic or whatsoever. Then you need the right audience. Now it depends on what do you want to do. Is it about something educational? So you are fighting against mis- or undiagnosis. In that case, it's very important to reach a very broad HCP basis. So it won't help if you really say, I look at this specific specialty. No, you have to go deeper. You have to understand what are all HCPs that might come in contact with patients, because these are the ones that do not know about this disease because it's perhaps some unspecific symptoms or not very clear. And so it really makes sense to have a look at that. And also you can look at comorbidities, or, for example, who are prescribing medications for comorbidities. This is also a very good hint. And then, of course, yes, you can do some social listening. You can understand what is the opinion around this topic. So this gives you better idea on how to talk about that topic. And then, of course, it's important, you know, what is happening on a patient level. You know the patient voice, but where are all these patients being treated? And not only on this disease, perhaps also on comorbidities. And if you have all that, it makes sense to personalize the invite, because you have defined different personas, different groups you would like to address with your campaign. And the more you address it to the specific interest of this HCP, the more, the higher is the probabilities they really will sign up and log in and listen to the webinar.
Yeah.
Yeah.
Yeah, I mean, I think like some of you may know all this anyway. Like, it's obvious that you should do these things, but like when you told me about it, I was like, this is like an absolute nightmare for me or for my clients, right? I've got to like do like publication mapping. I've got to look at like KOL mapping, for example, for every webinar. I've got to pick a specific topic that's like trending right now, which means like commissioning some social media listening research. I guess it's a nightmare to do all that. And I think like what I kind of challenged Julia to say is like, okay, like what I want is I want to, every 3 months when I'm planning a webinar, I want to just go to a page and I want to see all this stuff based on an idea of what the key theme is, like what's trending right now, and I want to be told all this information immediately so I can go ahead and plan a webinar. I was like, you can't do that though. But she's like, yeah, I can do it. And this was the really cool thing.
Yeah, thank you.
So, yeah, tell us how you did it.
So, no, you can, next step, you have planned the strategy, you know what the topic is, the audience, everything is defined. Webinar is done. And
So
if you have followed my advice, should have been successful.
Yeah, so I think like, you know, what we're looking at here is like, okay, you got a good impact. And by the way, if you want to see that dashboard like that I just described, if you've done the QR code, then we'll give you an opportunity to see that like live. Yeah. Like you can actually just choose a topic and look at it, and it will be right there in front of you. Like these guys showed it to me like at a conference, and I was just like, I couldn't actually believe that they were able to do that. But it's really cool. But I think like the important thing now as a marketeer, you want to go, okay, say I'm doing these webinars, say I'm getting I've got like 150 people come in every 3 months to those webinars. Now these are the people that I don't need to annoy with my reps going out to them, because I know they're interested in this subject area that they've gone to the webinar on. So I want to take that list of doctors, and I want the reps to be able to engage with them. And typically what would happen is, like, I would work with a client and we would plan like a follow-up, and everyone would get the same follow-up after that webinar. Or maybe you just so happen to choose something in the form and registration, you have 3 different follow-ups. But what you really want to do if you want to engage with a doctor on their level is you want to just be hyper-personalized. You want everyone to have a unique opportunity to engage in the topic of that they want, and give the rep the best experience of getting a yes to that email invite. So the next challenge I said was like, okay, how can you show me a doctor and give me as much information in one snapshot in like 3 seconds of what that doctor looks like based on third-party and first-party data? And she showed me what they got on that as well.
So you want to do the follow-up of your webinar. First thing, please do not ask things you might already know. So if you do it right, the HCP registers directly with his lifelong clinician ID, and you know directly who is that person. You have all the data and all the insights behind it. You know this person, and then you have all the insights, and this is very helpful. You gather additional insights on the HCP during and after the webinar. You know, how many minutes did he listen? Did he click on certain content that you showed him during the webinar or in the landing page? And also, did he download the content and so on? How many times did he log in? What did he look for exactly? And this gives you a lot of insights, and it's directly in the dashboard available and helpful. The other thing is you can look at the HCP before you start connecting with him. you can use this scientific sentiment to really understand the DOL opinion, because you see what are the main words he's using, what is he talking about in his publications, in social media, and so on. And this really helps you to address him with a topic that he's interested in. And that is important, and this is what matters. Another thing is you can look into publications, you can have a summary of this doctor, you see his peer-to-peer network, and this also gives you insights or also helps you to find other HCPs that might be like-minded. And then, this is how the loop closes. With the empathy, you know, each HCP has somehow a geography. You know where he's working. Then you have around him the patient voice. And this gives you unique insights because you know what is happening in his disease area with the patients, and is he in sync with the patients? So does he understand his patients or he doesn't? And if you talk to him and he sees that you have insights or that he's understanding his patients, or you give him value-added content or insights, this is very helpful, and it's so much easier to talk to the HCP because you have really getting a very close and deep relationship with him because you give him something he might not know or that really resonates with him. And then the next thing is all should be in the tools you are already working with. So no additional things, have it in your CRM, perhaps think about having an email notification on your mobile, so go away from these old-fashioned dashboards. This is not state-of-the-art anymore. Should be directly there where you need it and in the moment you might need it. And this is really hyper-personalized one-to-one HCP engagement.
Cool. I mean, and that's all the kind of the kind of sections. Is just to bring it back together. Like we've effectively got like a unique set of insights. So I'd encourage people to look for unique data if you want to differentiate from your competitors. Don't just think about your omni-channel strategy or AI strategy, like your capabilities and stepping ahead. Like you got to think about what information can you get about the clinicians that you want to target that your competitors aren't getting. So whether it's looking at the patient voice or finding your own unique insight that you can find, companies like Lee's can provide this type of data, and it's like finding those cool pieces of information that you can use to create really emotive campaigns. Then it's like, you know, making campaign planning easy. Like hopefully you've got some ideas on the types of stuff. You don't need to know everything about your audience. Like you don't need to know the minute details. You plan out the things that you would need to plan a webinar, and you put that on a dashboard, and that's possible right now. It's easy to do with platforms like Omnisia, and you can plug all that in, and it's going to be agnostic with your event management system, your Salesforce CRM, or whatever is going on. You can plug that all in, and you can see it in one place, and that's going to be super useful. And you can also layer in that third-party data, like the social media listening and things, and just imagine how useful that is to be able to see that in a snapshot. And then you've got the one-to-one experience. So you're kind of closing the loop with broad outreach, the people who are interested attending regular sessions and getting more and more engagement with you, building trust, and then the one-to-one engagement. It's like a simple way to build like a commercial model on an inbound strategy, and it's not overwhelming for marketeers to produce content in that way. You get used to it, you optimize it. So I hope that's been super useful in terms of just like a simple model, getting the data pieces. As I said, please use the QR code because you know, I can't talk to the technology of it, but these guys can show you the types of dashboards they have, and I would recommend that you connect with them and ask them to show you, like, because I think it would be a relatively simple solution and helpful for you guys if you need that kind of data. So if anyone has any questions, we'd be happy to answer them. No?
Okay,
all right, then.
We are super clear. Only one thing that I would like to add on, because if it's super easy to get these insights, it's super easy to create a webinar, it's all also in our platform. The more often you can do it, you can easily create landing pages and so on. It's all integrated in one platform. So this really helps you to do it on a regular basis, And then you will see a change in your data. And then you will see what I showed you, like this scientific sentiment. It might change because you made an impact with your engagement.
Yeah, James.
So Dan, you said it's really important to try and get that unique data, right?
Yeah.
But in essence, this isn't unique because anyone can purchase it, right? But can you integrate first-party data from your clients so that it does become unique over time? I might have missed that, sorry, but can it evolve to become unique to them while still accessing your platform?
It is. It can be connected with any client platform, CRM they're using, and then it will be enriched. Yeah.
Yeah, and so also I think on the third party side, like the patient voice and stuff, it's like you're specifically thinking about what, based on your hypotheses and of problems, you can then layer that. And as I said, I think that the step that like Lee mentioned there is like, yeah, it's the data, but you also have to be smart and like pull that together to make an insight. And I think like that's also the other thing. We talk a lot about, okay, unique data, we've got all these data sources, but you need to, yes, you can use AI to create some insights, but you need to talk to the audience and understand what's going on and you know, create a unique insight if you want a good strategy.
One more on that.
Yeah.
I think it's only second to AI, the word insight has been most used in this meeting, right? And it's bandied around
Yeah.
all the time. You're really good at this. How do you define an insight?
For me, an insight has to be unique. So, you know, MSLs talk about insights. They go talk to doctors, oh, we collected 6 insights. No, you didn't. You just collected some information. An insight has to be unique. And like I would say the key thing is it has to be revelatory. It has to be like a revelation. And a good way that I would use to describe it is, you ever go watch a stand-up comedian, right? The way that the joke works is that they see something in you that you didn't see and it makes you laugh. That's a really good way to imagine what an insight should be. It's like, oh my God, I didn't realize I do that, right? That is the thing that you need. And I think if you can bring that to a doctor, it means that they won't have realized, and you're never going to have you're never going to have real scientific exchange. An MSL with 6 months training can't talk to a 20-year consultant like in a real deep scientific way. They can share information and act as a connoisseur, but that becomes useless over time when they can use AI to find information or a rep. But what they can do is like, yeah, invest in giving them actual insights where they can build relationships of value. And I think that's super. Where you combine that with like the knowledge of like what's going on social media, what their peers are saying, or what the doctors are saying in the hospital, you know, in the next county. And like if you've got that in front of you, like if you can pull that together, which I've seen these guys do, and I think there's probably, you know, areas where people can input and say, well, can you get that in there? Can you get that in there? Like I think that's where we should be focused on trying to solve, because it's just going to help everyone to build more authentic relationships. Anyone else? All right. Thanks so much. Really appreciate attention. No, it's late. Thank you.